When we talk about feeding the infant, we talk about breastfeeding. That's the best thing the baby can have. It is pre-mixed, no mixing required. It always comes out at the right concentration pretty much. It comes out at the right temperature, and you don't have to do anything to it. There are some advantages that are also psychologic. Breastfeeding promotes bonding between the mother and the infant. There are immune advantages. The breast milk contains secretory IgA and other immunologic factors that help protect the baby. And certainly we know that babies that are breastfed tend to have a lower risk of otitis media and upper respiratory infections while they're breastfed. Also, babies that are breastfed tend to have lower incidence of allergies during that first year when they're feeding. They are not being exposed to any foreign proteins or allergens because they're getting breast milk. I always call it designer milk. Human breast milk is made for humans. That's the best thing they can have. There are also maternal advantages to breastfeeding. Many times moms will complain of cramping when the baby is nursing, and that's because the hormone, oxytocin, promotes milk letdown, is the same hormone that causes uterine contractions, and so that it will have some cramping. However, when the mom is nursing the baby, that causes the uterus to achieve its preconception size a lot faster than moms that don't breastfeed. Also, you are burning up an extra 500 calories a day just by nursing. Okay? That's an easy way to get back to your preconception weight. You don't have to do Stairmasters or Pilates or anything like that to lose weight. You just have to nurse the baby. You're losing 500 calories a day. There are a few contraindications to breastfeeding. Certainly HIV is one of them. And it has been found transmitted in breast milk, so it's not recommended that the baby nurse if mom has HIV. Other infections such as cytomegalovirus, it's contraindicated. Herpes simplex virus, only if there are lesions on the breast. Otherwise, it's okay to nurse. And hepatitis B virus, if the mom has been vaccinated, if the baby's been vaccinated, it's okay. Acute maternal disease such as TB, active or untreated TB, is also a contraindication to nursing. Breast cancer is another one. Certainly substance abuse. There have been many of these substances are transmitted into breast milk, and so it's not recommended that the baby nurse if the mom is actively on those drugs. There are some drugs that are absolute contraindications. There are some drugs that are relative contraindications to breastfeeding. Overall, there's very few. I already mentioned in the first chapter, we mentioned galactosemia as a metabolic disease where breastfeeding is contraindicated. And certainly one that you might get asked that's a high yield is a mom that has mastitis. Mastitis is not a contraindication to breastfeeding. In fact, it's encouraged because it helps the mom get better. And she can take certain antibiotics and still nurse the baby, and it'll get them better. Supplementation. Most breastfed babies don't need anything. Most babies don't need a heck of a lot of supplementation. But certainly they will need something in the first year of life. Iron is usually recommended starting at around 4 to 6 months of age. Babies are born with sufficient stores for the first few months, and then their stores start to go down, and therefore it's recommended that they be receiving iron-fortified either formula or cereals. The iron in breast milk is very available for the baby, more so than in cow's milk, and we'll discuss that in a minute. But there's a very high availability of iron for the babies in the breast milk. Most cereals and baby foods that are introduced later on in the first year of life are iron fortified, so that's a ready source. Vitamin D, typically not needed, although we worry about sun exposure or lack thereof. Most of us make vitamin D upon sun exposure to the skin, and so if you get out there and get a little bit of sun a couple times a week, you're probably receiving enough vitamin D. Certainly you do not need any extra water. Water is 0 calories. Babies will regulate their thirst mechanism by feeding. And whether it's breast milk or formula, they're getting plenty of fluid from that. You don't want to give just water because there's no calories and it fills them up. Fluoride is recommended starting at around 6 months of age. Breast milk, one of the things that does not contain much is fluoride, and we do need it for the development of the teeth. Also, babies that are having formula that is ready to feed, that has no fluoride in it, And if you are using water to mix the formula, then you need to know what the water source is in the community. If there's no fluoride in the water, particularly well water doesn't have much fluoride in it, then the baby just needs a couple of drops of fluoride as supplementation. Too much fluoride can cause staining of the teeth, so you want to avoid fluorosis. Vitamin K is given at birth. Vitamin K is produced by the bacteria in our gut. We love it because we can use that. However, when babies are first born, they do not have any gut colonization, and so they are low in vitamin K, and this puts them at risk for hemorrhagic disease of the newborn, which can present as occult GI bleeding or frank GI bleeding. So it's given intramuscularly in this country at birth, 1 milligram, and that takes care of it. Once they start feeding, they develop their own gut flora, and that produces the vitamin K, and it's a source for us. And also remember, specifically for the exam, if the baby is, for whatever reason, on goat's milk, they need to have folate supplementation. Just a quick question that they'll give you, and you know just to look for folate on that. Infant formulas can serve as a substitute or as a supplement. Sometimes, for whatever reason, the baby's not getting enough breast milk, and so you can supplement. And infant formula is geared, it's engineered to simulate breast milk. It'll never be the same as breast milk, but they try to be as close to breast milk as possible. The standard formulas are cow-based, cow's milk-based formulas, and that is given to normal infants. It is 20 calories per ounce. It is made with a cow's milk protein and lactose. It is modified so that it's not basically cow's milk. It is modified with other additives. And coincidentally, it's 20 calories per ounce, the same as pooled breast milk, 20 calories per ounce. So they really try to simulate or duplicate breast milk. There are some specialty formulas that preterm babies are given, for example, and those may have different, like vitamin E, they may have a higher caloric density, and there are other modified formulas for particular needs. For example, there are soy formulas, there are lactose-free formulas, and there's even more elemental formulas that are easier to absorb depending on different intolerances or different clinical scenarios for the baby. It's very important to know some of the differences between breast milk and cow's milk. We do not recommend cow's milk in infants. It's fine for a baby cow and anybody over 1 year of age, but we don't like to give cow's milk to babies. One reason, even though they contain the same amount of calories, one reason is the renal solute load. Breast milk contains a lower renal solute load. It's gentler on the kidneys than the cow's milk, which has a very high renal solute load, and so that can cause some renal problems. Another reason to use breast milk rather than cow's milk is even though breast milk has less iron, it is better absorbed. It has a higher bioavailability, and so there's less chance of iron deficiency anemia. Many times you may get a patient who is, like, for example, 15 months old and has been drinking nothing but cow's milk since 6 months of age and is pale with a high heart rate and a murmur, and the hemoglobin is 4. And that's because the baby has not been absorbing that iron, also has had some probably microscopic blood loss from the cow's milk, and that contributes to an iron deficiency anemia. That sounds like a test question, doesn't it? So again, we do not recommend cow's milk under 1 year of age. Typically at around 4 months of age, we start adding iron-fortified cereals. We do not like to add certain foods too early because that increases the risk for allergic responses or reactions. And usually around 4 to 6 months of age is when we start introducing other foods. It is a nice developmental stage. That's when the baby can grab its hands, put them together, and bring them to the midline and into its mouth. That's when the head control is much better, and the baby will tolerate the feeds much better. Even though I have here a slide that shows you when you should introduce certain things, it's basically a common sense thing. Introduce one new food at a time. That way you know if the baby likes it or doesn't like it. You know if the baby's going to have an allergic reaction to it or not. And it usually is about over a 5 to 7 day period. So introduce one food, try that food for 5 to 7 days. If there's no problems with it, you can introduce another food. You don't want to introduce a bunch of foods one day after the other, because if the baby breaks out in a rash or whatever, you don't know which one caused it. The other important thing to remember is the one at the very bottom of the slide. There is no honey to be given to a baby under 1 year of age. There's a very high risk for infantile botulism. These babies will then present with a descending paralysis, which can actually affect the muscles of respiration. So we do not want to give honey under 1 year of age. Also try to avoid egg white because of the allergenic potential, and citrus, as well as nuts. Nuts because of allergenic potential, and nuts because feeding them nuts, they're at higher risk to aspirate. So you want to avoid smooth objects for that particular problem.